everyone this evening for taking time out of your busy schedules to participate in this conference call. And TNEC certainly has come a long way since the pandemic started. And I'm very proud of our leaders and how the leaders responded to the coronavirus on a federal, state, county, and local level. And I truly appreciate the cooperation received from our residents to our workforce in making the sacrifices we needed to make to keep TNEC safe. I also felt it was important to put this together this evening so that the TNEC community could hear from our elected officials and health experts on the current status of COVID-19, the Omicron variant, and the importance of receiving the vaccine and booster, the current status of available testing for the virus, recommended periods of quarantine, and continued ways, very important to keep our families and children safe. We'll also answer some questions received from the community previously submitted to the township by email. And before I turn this over to TNEC Mayor Dr. James Dunleavy, I would like to personally thank Congressman Josh Gottheimer, who is connecting this evening from Washington, D.C., Deborah Cornavaca, who is the Deputy Chief of Staff of Governor Phil Murphy, as well as Michael Marin, the President and CEO of Holy Name Medical Center. And with us this evening are Doctors Luke Ironman and Suraj Sajar from Holy Name Medical Center. And these are people who always made themselves available and put the great residents of TNEC first. From the onset of this virus, these individuals have always made themselves available to me, my staff, the mayor and council of TNEC, in providing guidance and resources to keep us safe. Holy Name as well has been a tremendous neighbor and partner to the TNEC community, and I can't thank them enough. And just quickly, our fight against this virus is not over yet, and we must not let our guard down. Over the past 5 days, and this is not to alarm or panic anyone, but I want to be transparent. Over the past 5 days, TNEC recorded 555 new cases of COVID-19, and we have a total of 7,773 total cases since reporting began in March of 2020. Sadly, we've lost 124 souls to the virus. As I reported to the residents, because of the anticipated surge of positive cases after the holidays, I made the decision to close the municipal buildings to the public until January 18th to protect everyone, especially our workforce, from further spread of the virus. Unfortunately, every department in the township experienced staffing shortages due to positive cases. However, I'm happy to report this evening that those numbers are on the decline. I'm going to make a decision tomorrow in consultation with the township's health officer if we're going to reopen the municipal buildings to the public on Tuesday, January 18th, or wait an additional 2 weeks until we see a safe decrease in the average number of daily cases. And one last thing of importance, due to an increased demand in COVID-19 vaccines and boosters for the homebound population only, Holy Name Medical Center is moving from a phone-based program to an email-based program. The email address to use, and this is being recorded this evening, is homeboundvaccine@holyname.org. Again, that's homeboundvaccine@holyname.org. And that's the address that should be used to request a vaccine or booster. Due to the high demand and the limitations of their resources as well, it may take Holy Name Medical Center, their mobile unit, a week or more once your vaccination is scheduled. So again, that's homeboundvaccine@holyname.org. The mobile unit will come out, but it's going to take a week or more once your vaccination is scheduled. So Mayor, I'm going to turn this over to you, and you can do the introductions.
Great. Thanks a lot, Dean. Good evening, everybody. Good evening, TNEC, and thank you all for joining us this evening. I think Dean introduced our congressman and Deborah Cornavaca from the governor's office and our physician experts. In addition, we have Dr. Gina Miranda Diaz, who is our TNEC health officer. And also here are a couple of my council colleagues, Councilmember Michael Pagan, Deputy Mayor Mark Schwartz, and Councilmember Karen Organ, who is with us here this evening. So I know, Congressman Gottheimer, you have a very tight schedule. So I'm going to open it up with you. And if you could say a few words and Let us know anything you want us to tell us about COVID and what's going on.
Thanks, Mayor, and thanks for your leadership. Very grateful. Since moment one, you and the council and Michael and Karen have really just done a phenomenal job. And Deputy Mayor, of course, just a phenomenal job being on the front lines and helping folks, along with our frontline healthcare workers and our first responders. We're just very, very lucky in Teaneck to have such a great community that's been there. And I just want to say thank you to you and your leadership, and Dean as well, for your stewardship and as a manager. So the first, thank you. And Deborah, it's good to see you. Thank you for your work with the governor on these issues. And of course, I do want to thank Holy Name. Jim and I were there a couple days ago. From the days when you were literally ground zero of COVID, and I remember those early days. In fact, I was standing next to Mike Marin in one of our early press conferences, talking about the impact of the community, right, I think in the first weeks. And it just Holy Name has just done a phenomenal job stepping up. Of course, now just testing people, but on when the vaccines were required, when ventilators early on were required far too often, unfortunately, as they still are today, has been there. And I want to thank them for their leadership. And of course, Dr. Sugar, thank you so much for your work, and Dr. Ironman as well. And so thank you so much. I'm grateful. Our entire community has played a critical role, and there's so many people who played a critical role in public health officials, of course, and local leaders and experts. And I just want to thank everyone for their efforts. Obviously, we're dealing with another spike. The good news is we have vaccines. The tough news is we got to make sure everyone gets vaccinated, and folks masks and doing everything possible, given how this particular variant is spreading and how quickly it's spreading. That's something I think we saw, Jim, when we were at the testing center, with how many people were lined up to get tested, right? And I just reiterated and reinforced how overwhelmed I know our emergency rooms are, and we're short-staffed in our hospitals, all of our hospitals, because of I'll speak to our medical officers and all of our hospitals, phenomenal in our district, but because they're affected by the virus as well and breakthrough cases, and so many of our nurses and doctors and techs are out, which puts a lot of strain on our system, and we need to work hard every level. And so I just want to say thank you. So we got to respond promptly. We've got to continue promoting boosters and vaccines in our efforts to protect our children while keeping schools open safely. The masks and testing are key for that. And I know the state has provided testing. You can order tests at home, and I'm sure the governor's office will talk about this in a minute. But we know we have shortages on testing. We need more domestic supply. In fact, I'm going to Beck and Dick in Franklin Lakes tomorrow. That's actually on the cutting edge of the testing side, is actually as their own test. And they're producing them as quickly as humanly possible. I did the week I wrote and asked that you do everything possible to increase partnerships with our domestic businesses to increase supply of these testing, working with our sector leaders and using the full power of the federal government, including the Defense Production Act, and continuing to use the Defense Production Act. I also asked that we further utilize the National Guard to expand COVID-19 testing and to mobilize FEMA strike teams to staff health facilities, both long-term care facilities and our nursing homes and our hospitals, of course, to counter the shortage of staff, as I mentioned, in the hospitals and long-term care facilities because of the variant. I've also asked the federal government to expand availability of cutting-edge treatments that are effective against the new variant by expanding the availability of monoclonal antibody GlaxoSmithKline's, and supplying new antiviral drugs like Pfizer's Paxlovid to hospitals rather than just to retail pharmacies alone. This is something our hospitals asked for. And I've asked the state to continue its vital efforts to keep schools safely open for in-person education, obviously to protect our students, our children, our teachers, our faculty and support staff. It's critical for our kids' education, for parents and our workforce, to keep our businesses and our small businesses open that have really worked so hard through these years to keep fighting to stay open and to help provide services like in downtown Teaneck, and to make sure that our frontline healthcare workers can get to work and care for the rise in hospitalizations. I've also asked the governor to continue his executive order to temporarily expand healthcare professionals' licenses so frontline healthcare workers can assist where they're needed most. And the governor just did that this week. Grateful. My team and I are also regularly reaching out to long-term care facilities, nursing homes across North Jersey, check in to see that they are protecting our residents. And last week, we met with DeMava, New Jersey Veterans Affairs, which manages the Paramus Veterans Memorial Home, because I know we have people in Teaneck who have family loved ones there. So those are some of the steps we're taking, but please do everything possible to stay safe. Wear those masks. N95 masks, if you can get them, obviously are very important. Please get vaccine boosted. It's also very important. And just be safe. Test if you have symptoms. And let's do everything to stick together like the community has from minute one in Teaneck. And really, if we live up to those values, which I know keep Teaneck so tightly bound together as a family, and the council and the mayor do such a great job of making that happen. There's nothing we can't overcome working together here in the greatest country in the world. So God bless. Thanks for having me. Stay safe.
Thank you, Congressman. I know your time is short, and I really appreciate you giving us a few minutes and giving us an update. As always, Teaneck is indebted to you for all the work you've done for us, and we look forward to working with you in the future on many other things. So
Thanks,
thank you
Mary.
very much. Thank you.
Thank you.
Thank you.
All right. I think now I'm going to turn to Deborah Kornavaca, who is the Deputy Chief of Staff for Governor Murphy. If you have a few words to say, and then we'll start to get into some questions.
Sure. Thank you so much, Mayor. It's a pleasure to be here this evening. And to the Congressman who I know just left, it is a true pleasure to have great partners in Washington. He and his full delegation have been absolutely wonderful in helping us through this. I want to extend gratitude to all of the leadership in Teaneck. You have really set a high standard and bar for how to work through a crisis together, communicating with your community members, remaining in touch and accessible, providing critical services, helping to de-escalate tension and stress that could happen because there's so much concern and fear and propensity for misinformation. You've done such a fabulous job, and we really appreciate it. And it's an honor to be able to be here on behalf of the governor. And just a special shout out to Holy Name, to all of your healthcare workers and your frontline workers. We know that you're going through a really tough spot right now. We are in your debt now more than ever, because what you went through last year should have been the last of what you had to go through with respect to this virus. And we know that it's come back with a vengeance and is challenging you in ways that we wished would never happen. But we so appreciate everything you're doing, all of your healthcare workers. Everybody in that hospital we consider a healthcare worker, the food service, the custodian, the nurses, the doctors, the aides, the assistants, everybody. We owe you all an extreme debt of gratitude. So greetings from Governor Murphy. We wish you all a happy and healthy new year. It maybe is a little bit of a bumpy start, but we're really optimistic about this year and about moving through this temporary crisis, a tsunami, as the governor has called it before. You have to excuse me, I'm home and I have a bird. He likes to talk when I do. But, we're very confident of better days ahead. Omicron is without a doubt part of a perfect storm, right? We've had the cold weather come in. We've had the holidays when people were gathering. We had this new highly contagious virus variant coming off of Delta, which was, contagious enough. And then we had the vaccines that many people were 6 months out from or more, where the maximum efficacy was beginning to wane, right? So it's set up for where we're at. So it's explainable and understandable. And that is so important to know, because that means we know our way to work through it to the other side, right? We know that getting vaccinated is still critical, and the doctors will speak to this more than me, that the vast majority of people we're seeing critically ill are those who are unvaccinated. The next category are those who are unboosted. So getting vaccinated and getting boosted, I'm not going to worry myself personally about whether it's tailored to the Omicron virus. I look forward to the day that is one. But right now, we know that the vaccines on the market help provide protection against serious illness, hospitalization, and death, of which we are still mourning the loss of so many people in your community around the state and nation. So we know that will really help. So we also know the mitigation measures that we didn't necessarily understand as well a year ago. We know more about what masks make a difference. The high quality masks we're trying to encourage people to wear now make a difference if you can have access to them. We know more about ventilation and air quality that help us get through this. And we have more ways to treat the virus when people do require treatment. So while we are in a rough spot right now, I want to emphasize that our optimism doesn't come from sugarcoating where we're at. We're seeing spikes and peaks like we've never seen before, but it comes from the mitigation measures that we understand and the understanding of why we're at where we're at and knowing that we will work through it. We've also seen the Omicron virus behavior in South Africa and some in Europe. We've seen it peak quickly, and then we hope descend equally as quickly. We can't make for sure statements here. Things are dependent on population densities and vaccination status and climate and all of those things. But we know, we understand a lot about this virus, about our vaccines that we didn't a year ago. So I think my first message is to let's weather this storm together. We've done it before, we can do it again, and we have a really clear path forward to better days ahead. The second thing I'll say is that while the governor has redeclared a public health emergency to allow us to have the powers that the congressman and other necessary powers within healthcare and vaccines and testing, it is not a forever. We do public health emergencies based on 30-day rotations. The governor is looking forward to the day he doesn't have to renew it. And so you should know that where we're at today is not where we're going to be at looking down the line in a few months. The third thing that I'll say is that we have learned so much in the past year about partnerships and infrastructure and how to fight a pandemic. So the partnerships that, for example, you here in TNEC have extended to the congressional level, to the state level, to bring in information, to work in collaboration at the county and municipal levels, we are able to deliver services and get people connected to what they need. What I just heard about providing senior assistance so much more quickly than we were a year or 18 months ago, because unfortunately we've learned a lot from this experience. We wish we didn't have to go through it, but every single person who's part of this host room right now has learned a lot, and we can help better and more than we were. And so have all of you who are listening. And so with that, I would just say that we hope everybody's learned the importance of the vaccine. We are doing very, very well in New Jersey with over 7 million people who are fully or have at least one dose and over 6 million who are fully vaccinated, but far fewer have gotten the booster. And we want to share the message that it is never too late to start the vaccine. You haven't missed the boat. The ship hasn't sailed. There is no shame. If you haven't gotten it yet, for whatever reason, it's not too late. Let's step up and get you vaccinated. If you still have questions, to ask the doctors who are here today or find another resource. In the governor's office, we host regular vaccine information sessions with a phenomenal doctor who's a consultant for us. Happy to invite people to that and share those invitations. But let's get you the answers and let's help you find a way to get vaccinated. If you're vaccinated already and you're thinking, oh, I'm pretty good and I'm not that risk and I haven't gotten boosted yet, now's the time. Let's get it done. We're heading into cold months ahead for a while. We're going to be more indoors. There is more gathering. We've got to just take that extra step and get boosted. And let's get our children vaccinated. While the 11 and up is moving, is 15 and up more so, the 5 to 11, we're still lagging, and that's understandable. It's more recent, but there also may be parental reasons for not being eager yet, being concerned. I understand that. I'm a parent of 3. Let's talk to your pediatrician. Many of them have the vaccines. They want to help you. They want to answer questions. We want to answer those and help you get vaccinated. We know that keeping our schools open will go smoother and easier when more of our children are vaccinated. So we really continue to ask for your help and cooperation, both for yourselves and your family, but for your community writ large. If you're a faith leader or a business leader, make sure that information is accessible to your constituents, your colleagues, and your friends. Take some time to find out if they need questions answered. I think of it a lot about how we ask people, have you voted yet? Do you have a plan to vote? A number of years ago, a long time ago, I won't age myself, it was kind of taboo to ask people, have you voted? It was like none of my business. And now it's like fashionable. Hey, do you have a plan to vote? Yeah, I'm going to vote before work. We should be able to talk about the COVID vaccine with the same level of comfort and the same level of dialogue so that it's part of our normal lives, because that's how we're going to move through this. So the medical experts will speak more than me to when we think Omicron will be better, but we are starting to see signs that we are at or near our peak in New Jersey, and that things are starting to stabilize. But in that stabilizing, we are still putting our health institutions under tremendous stress and pressures. So we do ask everybody to take special care. Wearing the masks helps against COVID. It also helps against the flus that are spreading and a lot of other ailments. If you're not feeling well, stay home, get tested, take the time to make sure that you're not spreading something unintentionally. And let's take extra steps to really take care of our immunocompromised and our immunosuppressed people with medical conditions for whom it may be a much more serious impact of COVID. And one thing which I'm sure the doctors will talk about more than me if there's interest, but I just want to make a clear distinction. There are people in the immunosuppressed and compromised world who need a third dose. That is separate from a booster, separate and distinct from. I don't want to go too in the weeds here, but make sure you know that if you are immunocompromised or suppressed, you can get a third dose, and that is a different regimen than the booster shots that everybody else should be getting. We know testing has been hard lately. We have tremendous help from partners in the city, municipal, and county levels pushing out more testing sites. We know our labs are overwhelmed in running the tests, so you're not always getting the results as fast as you want. Those labs are facing the same personnel shortages that everybody else is in our schools and our stores and everywhere else. So we have to bear with it and be a little bit patient. There is the online ordering of tests from Vault, and I'll put a bunch of links in the chat box when I'm done, and I promise I'll wind up in a minute, Mayor. But there is an online ordering you can do from the state for a free test to be shipped to your home. I want to be clear, it's not a rapid test. You do have to log in with Vault to make sure that you're taking the test properly. It's a saliva test that you'll take and then mail it back. So it is a multi-step process. You have to request it, receive it, take it, send it back, get the results. So it's not a rapid test, but if you do need a test kit, you can do it. I will just put the caveat on that the demand has been so high that I think they release, I can't remember how many, if it's 6 or 8 or 10,000 tests a day. So if you log in later in the day, they may tell you that they have given out all the free tests they can for that day. They will allow you to proceed, but they would ask for you to charge. I don't encourage you to pay for it unless you really want to. You should just try and go back in the next morning to order your test. We also know that the federal government is setting up their plan to do tests. I don't have the details on that infrastructure. So we are doing everything and we can in conjunction with our partners from the state, federal, county, municipal, healthcare providers to increase it. But just know that while it is frustrating right now, think back to where it was 18 months ago when there weren't even actual tests anywhere to find. We are doing a lot better and we will weather this storm with a little bit of patience, a little bit of grace. We will get through it. I know there were some questions, Mayor, so I think before I go on any longer, I'll just defer to you so that if I'm taking up any more of your time, I'm doing it in what interests your constituents here. But let me just say, you have a phenomenal town, an incredible spirit of community here, and it is a real pleasure always to be part of it. Thank you.
Thank you, Deborah. Deborah, what I'm going to do, I think there's 2 questions here in particular that one is more informational, and if you have the information, if you could put it in the chat room. If not, if you could send it to us and we'll post it on our website. And that is, we did have a question or 2 regarding concerns about price gouging relative to COVID-19 testing. And where would our residents go, or would they send a complaint or a concern to in order to have that checked out?
So I'm going to put our email address to receive complaints in my office into the chat box in just a second. I do not believe, I have not been able to confirm that we have a portal set up for price gouging on testing. We did around other supplies earlier, but I will just say that the most effective way that I'd like you to utilize is to email my office. It's at outreach@nj.gov. outreach@nj.gov. It'll be in the chat box. If you send us an email with the test company and what's happened, we will immediately send it over to an investigations team. They are adamant about not letting this get out of control, and they will deal with it.
Great, thank you. And then the other question that I would like to ask you is, in terms of the statistics that we see, and I go to the COVID dashboard every day to take a look as a practitioner. There is a question though related to the number of cases in a hospital, whether or not they were actually admitted with COVID or for COVID, or when they came in with another ailment that through testing, which we all know everybody is getting tested, they then come up as positive. Is there any way that that can be teased out so the public has a better idea?
So our partners at the hospital may be able to tell you a little bit more on the intake side. I will tell you with the state level that almost any data, they can be disaggregated and pulled out. It's just incredibly time consuming. So hospitals will know when a patient is coming in, whether they were coming in for COVID or another reason and then positive diagnosed. That will go into their filing, whether it's electronic, most of which it is or not. But we would have to pull all that from them and aggregate it in a way to do an analysis. So I think individual healthcare institutions have a better sense of it, but we haven't formalized a standardized way of reporting that at the state level yet. And this is one of those places where I would ask for a little bit of grace and understanding, just because while I think it's a really good data point to know, it is extremely time consuming at the state level to pull all of that in. Remember, prior to COVID, we did not even have standardized reporting for all of our medical institutions in a lot of ways that we now do. So we're moving in the right direction. And I would say down the line, we'll be better able to give you more granular detail more easily. But I would refer people right now to our dashboards at the Department of Health for the best available data that we have. And then the CDC site, and I can put these links in the box to give you a national perspective as well as broken down by state. I do not know of a place that reports that, except maybe at hospital levels, and they may not report that publicly. But my colleagues from Holy Name will certainly correct me where I may be awry there. I would just say that the stress on our infrastructure, our human capital infrastructure in the Department of Health and elsewhere has to be prioritized. And so right now, I don't think we're likely to build that out.
Okay. All right. Thank you. All right. I think we'll turn now to our experts from Holy Name, Dr. Segar and Dr. Ironman. And I'll kind of throw these out. I don't care which one of you take it. Feel happy to talk over each other, your colleagues, right?
Absolutely.
Right. So I guess really, what is the status of Holy Name right now? The current increase in cases, obviously, it affects Holy Name. It's affecting the facility where I practice. And give us a sense of how many patients are you seeing that are vaccinated versus unvaccinated?
Sure. So I can start, and I want myself and on behalf of Dr. Ironman, we want to thank Mr. Mayor for having us here. We're proud to represent Holy Name and Mr. Mike Marin, and thank you for the congressman and the governor's leadership as well. So it's our privilege to be here, and I want to thank everyone that's tuning in. Because as I always say, this has truly been a pandemic in the first pandemic in the social media era, and there has been a pandemic of misinformation. So I think by people tuning in and understanding and going to trusted sources for medical information, it's extremely important. So we're really appreciative of people taking time out to listen tonight. In terms of what we're seeing, as Congressman Gottheimer alluded to, we certainly were the epicenter of the first wave in the New York tri-state area, and we've suffered and weathered many waves since then. And certainly Omicron is no exception. The hospital experience is much different now in early January than it was only a month ago in early December, prior to the rapid explosion of cases and the rapid replacement of Omicron from Delta. So what we are seeing in the hospital, certainly I'll give a very general overview and then we can dive into specifics, is that we have seen certainly a large percentage of cases of COVID-19. The positivity rates, as we all know, are sky high. But people always ask me, just because you're positive, does it mean that you're actually coming to the hospital very sick? And if we tease out in terms of vaccines and under-vaccinated status, certainly far and large, the proportion of people that are admitted that are what we call severe to critical COVID-19 are either non-vaccinated. Under-vaccinated means they maybe never got boosted, or maybe they got their first two primary series of the vaccine more than 6 months ago. Perhaps they're immunosuppressed and they never mounted a proper response to begin with. So I think that's important for everyone to understand and to reassure people that indeed the vaccines do prevent serious disease. They may not prevent illness, right? We know plenty of people that have been vaccinated that have gotten positive COVID-19 and certainly with Omicron, predominantly milder upper respiratory tract signs and symptoms. I think it's important for everyone to understand that's what the vaccines were designed to do. They're designed to prevent disease, designed to prevent severe to critical COVID-19 and prevent hospitalizations and deaths. So certainly if you look at percentages, the overwhelming majority of people in the severe to critical range that we look at when we look at patients and kind of group them in different areas as opposed to mild and moderate, are undervaxxed or non-vaxxed. That's not that having said there's not exceptions, there's always exceptions to every rule, but that's certainly what we're seeing on the ground. As has been alluded to earlier, it's been peaking daily. We now know that in the New York tri-state area, New Jersey, New York, we have seen somewhat of a stabilization over the last 2 days in terms of new cases and hospitalizations. I would caution anyone out there, that's a very short time period in medicine. We look at a lot of data. So having 2 days, Sunday versus now Thursday, is not enough time to definitively see. We have definitely seen a peak, but certainly in the UK and South Africa, they saw a rapid rise and a rapid decline in cases. And we're very hopeful that that may be the same. Just in a very general overview, hospitalizations and deaths do lag behind cases. So people that develop COVID-19 for various reasons that have risk factors, or they're under-vaccinated, they're immunosuppressed, they will perhaps go on to hospitalizations and deaths, oftentimes happen 7-10 days later. So we're certainly not out of the woods by any means. And understand there will be a delay, and we may see new cases dropping. We'll still see the strain on the healthcare system that was alluded to earlier. Of course, that's a reflection of just fatigue, the national healthcare worker shortage. Just last week, we had over 160 employees of Holy Name out with COVID-19. So we have a lot of moving parts, so to speak, but certainly we'll weather the storm.
Great. Dr. Ironman, do you have anything to add?
Dr. Sager did a pretty good job representing. We are, sorry, as Dr. Sager said, right now our volume seems to be consistent. We're seeing about 15 patient admissions a day. The majority of them, again, are unvaccinated or under-vaccinated. These tend to be our sickest patients. So again, the importance, the best tool we have against this virus is to vaccinate and to boost.
I know people are worried. I know patients that I see are worried about thinking that if you go into the hospital, you're going to get put on a ventilator. And I think from my understanding, and please chime in on your experience, it seemed as though we're using ventilators less on these cases.
That's correct, Mayor. The Omicron, if you look at what we call the pathophysiology of how this virus works, we're learning more and more that, yes, it's not as severe. It doesn't mean doesn't cause significant illness. But part of that is that it causes upper respiratory tract infection as opposed to lower respiratory tract. So we're not seeing as much pneumonia leading to respiratory failure and intubation, and ultimately, oftentimes 85% or more, those patients succumb to their illness. So we're seeing more upper respiratory tract. That's why people tell you, well, I have congestion, I have a headache, I have a runny nose, water your eyes. It's become much more of an upper viral syndrome. Of course, I caution it can be more serious in children, especially very young children who are unvaxxed, who have smaller airways. That's why you're seeing an increase in hospitalizations across the country in the pediatric population, especially 5 and under, because they develop things like croup or bronchiolitis, which are just fancy words for upper respiratory tract infections. Their airways, just because the physiology, are small to begin with. But certainly we're not seeing the rush in the ICU. So if you look at cases, people are still sick, absolutely. Yes, Omicron causes less severe disease. Doesn't mean it doesn't cause significant disease. People may have shorter stays. We are better able to send patients home on home oxygenation. We have telehealth now. Holy Name is piloting a Medicare program at hospital at home, which Dr. Ironman is in charge of. So we have a lot of initiatives and a lot of advantages at our disposal, including therapeutics, monoclonal antibodies, antivirals, and just quite frankly, experience that we did not have in March, April, May of 2020, which, yes, as someone on the front lines, we saw a large amount of people that ultimately required intubation. We had a pop-up ICU, 60 plus patients, all intubated. It was a terrible scene to behold. I'm happy to report that we have not happened to open up a pop-up ICU at Holy Name. We've been able to maintain our current facilities and stay ahead of the of patients. And so we're very thankful for that. But again, just because it's not as severe does not mean that the disease is not significant.
Yeah, a lot of people are a little bit confused about the testings, rapid test versus PCR versus other things. Could you kind of go through those and tell us exactly what and maybe the efficacy related to each other?
There's really only 3 tests. When we say rapid, in general, that means an antigen test, or you can have rapid PCR. So if you just understand there's antigen test, which is looking for a protein on the surface of the virus, a PCR, which stands for, if you really want to know, polymerase chain reaction. It's a molecular test. It's testing for RNA. It's a much more sophisticated test, but of course it's more time consuming. It's more expensive. requires lab expertise, et cetera. And then you have serology, which is antibodies. And that's a third test. We usually don't use it for diagnosis purposes because it takes a while and it can be hard to interpret it. So when you say a rapid test, in general, people mean rapid antigen test, although now through private industry and other avenues, there are rapid PCRs and even at-home PCRs that can be done. But again, there's an antigen test, a PCR test, and serology. If we talk about diagnosis, we'll focus just on antigen and PCR. Antigen test has the advantage of being inexpensive, rapid turnaround. You can do it at home. You get the results in 15 minutes or less. The problem and the issue is a couplefold. It is not as sensitive as the PCR. That means it can miss disease, especially early on. The PCR is much more, it can pick up, and so it's very sensitive. It can pick up very small pieces of RNA and make that diagnosed very quickly. But it's not practical on a widespread population basis to offer PCR. It's too expensive. It takes too much time. There's too much lab expertise, et cetera. So the antigen test is a happy medium between the two. What I would tell people is that if an antigen test is negative and it looks like it smells like COVID, especially now, since we have such a high currently, that may change, we hope, in the coming weeks or months. But since we have such a high community spread of COVID-19, if it looks like it smells like COVID and your antigen test is positive, then we do recommend checking a PCR. And we've seen that certainly in the hospital where you had people who came in negative antigen, but you still had high suspicion, and indeed you do the PCR, it's positive. So the problem with the antigen test is that it can have false negatives. The false positivity rate is very low. There was one brand that's been taken off the market, so that shouldn't be an issue for anyone listening out there for false positive, but there can be false negatives. So that's the trade-off. You're having a cheaper, more widely available test that can be done at home. It doesn't require technical expertise, but you give up some sort of sensitivity. PCR, on the other hand, is a molecular test. It's very sensitive. However, it's almost too sensitive. So if someone recovers and they test a PCR 10 days later, they're still positive, oh my gosh, what do you do? That's why we don't recommend, in general, a PCR as a test of cure, because a PCR cannot differentiate active virus from non-viable, just shedding. So if someone has just little bits and pieces of RNA in their system, the test is so good it can pick it up. So these are kind of the trade-offs. I hope it wasn't too technical, but antigen and molecular tests, the rapid almost always alludes to an antigen test. The confusing part is that now there are the availability of rapid PCR tests as well. It's still not as available as the rapid antigen test.
Okay, thank you. Another thing that people I think are confused about, and I'll put myself in that, and that is when a person has COVID, is there a time frame that they are actually more able to transmit the virus to others, and what is it and what should they do?
Yeah, sure. In the infectious disease world, which I live in for a long time, in general, but certainly the last 2 years, I've been living pretty much there, is that we look at things like incubation period, we look at infectivity. So with Omicron, things have changed. The incubation period has shortened. So the time from someone getting infected to showing symptoms is in general about 2 days. That's actually a better in terms of contact tracing. If we look back at the Wuhan strain or the wild type or the alpha and beta, where there was a longer time between being infected and then actually showing symptoms, and that made it much harder to contact trace. So now when someone gets infected in general, they're going to show symptoms in some way, shape, or form within 2 days. Our understanding of how infectious someone is shortened. In the beginning, we thought 14 days that someone's still infectious, then 10 days. We now know the person is most infectious 1 to 2 days prior to the onset of symptoms. So if they're pre-symptomatic on a Wednesday, they're most infectious starting on Monday or Tuesday, and then 2 to 3 days following the onset of symptoms. So if they show symptoms on a Wednesday, by Friday night or Saturday, they would no longer expect it in general. This is not absolute, but if you look at a bell-shaped curve, the vast majority of people would follow that 1 to 2 days prior and 2 to 3 days after. And that's really the impetus and the science behind the CDC shortening their quarantining times for someone who is sick and then asymptomatic. If someone rapidly clears the virus, and we see that in people who have the vaccine, right? People say, well, what's the point of the vaccine? I got infected anyway. One, it kept you out of the hospital. And two, the time you're infectious is much shorter. It's a much narrower curve. The antibodies still work. So your viral shedding time, the time that you can then subsequently transmit to someone else, has been shortened. So in general, you have that narrow 2 to 5 day, 2 days on the one side and 2 to 3 days on the other side in terms of how infectious you are. just understand that a PCR can stay positive for some time. We see in the hospital all the time, someone came in for a hip replacement or some elective surgery, and they tested PCR and it's positive, but they tell you why I tested positive 10 days ago or 2 weeks ago or 3 weeks ago. And so that is something we have to understand and then differentiate in a case-by-case scenario for all patients that come in the hospital. There was a question earlier about, incidental COVID. Certainly when you're having such a large percentage of the population infected, you are going to see incidental COVID. We know that. It doesn't mean the vast majority of patients being admitted are COVID. And I'll just piggyback because I think a lot of people will say, well, gee, aren't all these patients being labeled as COVID when they're coming in with something else? COVID or SARS-CoV-2, which is the virus that causes COVID-19, is very tricky. It affects the entire body. We call that in medicine multisystemic. And so it can affect a whole variety of body systems. So someone might come in dehydrated with their kidneys affected. Actually, it could be COVID. They could have diarrhea or GI symptomatology. That could also be COVID as well. So that's some of what makes it somewhat of a wily opponent is they can affect the entire body. So we call multisystemic. The entryway, the receptor, if you will, that the virus uses to gain entry into the body is found throughout the body. It's found in the heart, it's found in the liver, and found in the pancreas. And so the virus can affect different parts of the body. And that's something that we as doctors have to understand. It's a very broad disease with a lot of different manifestations.
Okay, terrific. Thank you.
Sure.
I think this is a quickie, but it's one that I know I hear a lot. Should someone get a flu shot even after they've been vaccinated for COVID?
I would tell you that there is no reason to wait anytime. You can get them. Absolutely, you can actually get them at the same time. The only reason to wait is if people are concerned about side effects. So if I have a sore arm on my left, and then I get if I'm right-handed, I tell people get your COVID-19 vaccine on your left deltoid. Well, then, there is some soreness associated. I'm not afraid to admit that I had, the dreaded man cold where I, for a day, stayed under the covers and my wife made fun of me. But, I tell people that so people will be encouraged to get the vaccine. It's really not a big deal in general. But yes, the soreness in the arm is something that, I would not underestimate. So I'll tell people if you're concerned, you can wait 5 days, 6, 7 days, but there's really no reason to wait. There's no definitive time. There's no such scientific data that says you have to wait 2 weeks or 10 days. In fact, going forward, if indeed we do require, and that's still to be determined, yearly COVID-19 boosters to account for different strains that may come once this virus becomes endemic, which most likely it will, and we can talk about what that means. There's even research going on looking at a dual vaccine that to increase compliance, that you would give a flu and COVID-19 booster at the same time. So the short answer is that there's no specific time period. And if someone feels that they can get both at the same time, they should do so. It's very important. We have seen cases of influenza and COVID-19 at the same time, the so-called twindemic or flurona, if you will, that is in label in the news. And we have to remember that influenza in any given year kills between 30 and 40,000 Americans every year. Usually they're very old and they're very young, they're very vulnerable. So this is not something to be underestimated. And we have to remember that getting the flu shot is as important as getting COVID-19 vaccines and boosters.
And would you say the same thing for people who have questions related to pneumococcal vaccine or shingles?
Sure. So again, all very important vaccines to receive if you are at high risk based on your age, and there's different, which I won't get into today, in terms cutoffs for both the shingles or the herpes zoster, which is really the varicella zoster virus vaccine, as well as the pneumococcus or strep pneumo, which is the most common bacteria that causes bacterial pneumonia. In those cases, also very important to get. In general, I would wait maybe 1 week between shots. The most important thing is not to get any vaccine if you are feeling sick, if you're feeling febrile, et cetera. The reason is you want to give your body the best chance to provide an immune response to these vaccines. So if someone's getting over a cold, maybe it's COVID or otherwise, especially if they're febrile, they're having a fever, I would not recommend it. Make sure that you have recovered from that acute illness before getting a vaccine. That's true for any vaccine. But again, we can't let, as Dr. Arman will allude to, we saw, across the country, people letting things like colon screenings and routine healthcare fall by the wayside, especially in the first and second waves, because of fear of either coming to the hospital, going to the physician, or just misinformation. And we can't let other very important medical issues and health concerns and health screenings and health maintenance fall by the wayside.
Great, thank you.
Sure.
Let's move on a minute to the ever popular mask questions. Um, as many of us know, and we see every day, especially those of us who work in hospitals and in healthcare, we are absolutely assured that there isn't a chin in America that is contracting COVID, because that's the only thing that's covered by the mask, right? We see that all the time. And for everybody who's listening, it's important to have your mask on over your nose and under your chin, regardless of what type of mask it is. That's got to be essential. But we've heard a lot, obviously, about the K95s, the KN95s, surgical masks, and obviously the cloth masks, and even we saw someone from CDC double masking on the news. Could you tell us what you feel is the most important thing that our residents should be doing, especially when they're outside their home, and maybe once outside the home in another environment indoors where they're with other people?
Yeah, so if you look at masks, first and foremost, far more between people deciding should they wear a K95, an N95, a cloth mask, a gaiter, which we don't recommend, a 3-ply cloth mask, is that it's not as important as which mask you wear. It's really as important as you wearing it properly, as you alluded to, and that you're wearing it consistently. And we have seen that people that may feel more secure wearing a K95, or in general, the general population should not be wearing an N95 because they're not what we call fit tested. When we go to the hospital, we're fit tested. It's secured for our face and our size of our face. And so that's why we don't recommend the general public using an N95, but there are KN95s, which have been, usually imported from China and other places that aren't necessarily secured for or certified for healthcare workers, but they do provide a tighter fit than, let's say, the surgical mask or the 3-ply cloth mask. But what I would say overwhelming is if someone's wearing one of the more tighter fitting masks and they're uncomfortable and they don't wear it all the time, they say, well, I'm wearing it for an hour, but the rest of the time it's just really too uncomfortable. I'm not going to wear it, or I keep touching my face, or I keep taking it down every 5 minutes. That really defeats the purpose. And so I really would urge people to be more consistent about their mask wearing. That's really more important. I think the dialogue has gotten a little bit out of hand, so to speak, in terms of which mask you should be wearing. It's really the consistency and the proper application of the masks. Again, we see it all the time in the public, noses peeking through or peeking over their mask. That really defeats the purpose of a mask, if it's just laying on your chin, obviously. So I think people should realize, now, should you wear a mask, right? We know it's extremely effective. Unfortunately, like vaccines, this has become politicized. It's very unfortunate. But if we look at just a simple intervention that anyone can utilize, yes, masks do work. Now, of course, you have to look at your individual risks. We know that someone who is maybe in their 20s and they're vaccinated and boosted are saying, they may be less likely to be afflicted in a negative way. Their motivations for wearing masks may be slightly less or significantly less than someone who is older, who has what we call comorbidities. They may be immunosuppressed, or they may live with someone, that's important to remember, may live with someone who's immunosuppressed, so they may not be affected, but they're bringing it home to loved ones, family members, friends who would have certain attributes that put them more at risk. So I think that's what you have to really look at, is the consistency of the mask wearing, the proper application of the masks. If you're taking a mask and it's very tight fitting in the hospital, certainly, we wear masks the moment we walk in until we leave. Yes, when in my office, I close the door and I take it down. And especially in the early waves, we wore N95s the entire day, right? We just didn't know much about it. Now we wear N95s, we wear goggles whenever we see patients, but oftentimes we wear surgical masks when we're in the common areas in the hallways. It's not comfortable. I had lines all over my face, like all of my colleagues. It's hot, it's uncomfortable, but we realized it was a matter of life and death for us. There was no vaccines. We didn't have a good understanding of this virus and this pandemic. And so we kept it on. It's not reasonable to expect the general public to keep it on that consistently without taking it down, without contaminating their face, without touching their nose, rubbing their, maybe scratching their nose, et cetera. So, again, I just want to reiterate, it's a simple concept, masks. It's been somewhat marginalized in some discussions. It's been really misaligned in some discussions, but it's a very effective way at reducing and mitigating one's own risks of acquiring COVID-19 or spreading, in addition, obviously, to vaccines, but it's really the proper application and the consistency of use in the indoors.
Great. Okay. Circling back to, I had a number of questions related to the quarantine, and any of us who had to dig through the new CDC guidance on this knows that it's a little difficult to understand. But one thing in particular, a question from a resident: if I'm traveling and I discover that I have been infected, how long should I self-quarantine?
All right, so when they're traveling and you're infected, so it means they are, again, some of this also depends upon the locality of where you are traveling. I mean, if internationally, and it certainly varies from country to country. So I would defer to the home country's rules. You know, if someone is domestic and they are now, they're traveling from New Jersey to sunny Florida, you know, if you're fully vaccinated and boosted, yes, after 5 days, you can consider getting a test negative and flying home. It really depends upon each individual situation. And you know, and I'll preface this by saying we're well aware in the healthcare community that the guidance and the wording has been very confusing from the get-go. And that's something that, you know, we certainly hope at a federal level that would become more clarified. But I will say that this pandemic has evolved in real time. So people ask, you know, how can we trust the guidelines that keep changing? And what I tell people is the guidelines and any of the science changes as our understanding of this pandemic and this virus changes. If we look at how we treated patients at Holy Name, and this is true for any hospital in the United States, in March, April, May of 2020, it's vastly different than March, April, May of 2021, and vastly different than it is now. So that's a reflection, not just because we're changing our ideas at a whim, but because we are taking the best available science. We live in a evidence-based world, and as our science changes, so do our guidelines, treatments, therapeutics, et cetera. So when people in general say, well, the CDC keeps changing their mind, it's really no, they are utilizing the best available science at the time. And as that evolves, so does the guidance and so does the recommendations. Of course, the confusing part, I think, with a lot of us in the medical community was, do you need a test, you know, to return back to work after 5 days or not? And that is still an area of controversy. Obviously, certain unions were against going back to work without a confirmatory test. And that's why I think I spent a little time discussing with you the two types of tests, because you can understand that you can be get sick on a Monday, feel better by a Wednesday, and by Friday no longer be infectious, take a PCR and still be positive. So I think it's important for the general public out there to understand that if you do decide to test prior to going back into the general population, employment, whatever it might be, understand what test you're taking, and understand that on a bell-shaped curve, the vast majority, 85% or more people, will no longer be infectious 3 days after the symptoms started.
Great. I have one or two questions left, but before I forget, Deborah, I have a number of questions from residents with respect to the fact that Medicare does not cover testing, does not cover the rapid tests. And I know this is a federal issue, but if you could convey to the governor that our Medicare population, while the Biden administration is looking to get as many for free in the hands of as many people as possible, the Medicare population is kind of out in the cold in terms of having to pay for it. So if you could convey our concern for that, to see whether or not you know, some pressure can be placed upon it. I'll be talking to Congressman Gottheimer about that as well.
Absolutely.
Let's see. Now there's I've seen a few things in the news about potentially another strain that's coming after Omicron, and what was the status of that and where it was going or what's going on?
Yes, so that was in Cyprus. In the Mediterranean, they had discovered a combination of Delta and Omicron, so-called Deltacron. So we, you know, oftentimes, many times during this pandemic, someone hears some news and they run with it. And I had seen things on social media from my friends who were Facebook, you know, it's a joke, Facebook certified infectious disease physicians. And the reality is that, you know, we always wait for the science to catch up. And very quickly, we realized that this was not showing up anywhere else in the world. And lo and behold, I will spare you all the scientific data, but we realized this was nothing else than a contamination. So if I told you that the PCR is so sensitive, they realized in the lab they had Delta, and then they had the Omicron, and there must have been some very microscopic amounts of RNA left in the lab. And so then the PCR, that very sensitive test, picked up attributes of both Delta and Omicron. Someone very quickly called Deltacron. And it was interesting, and from a scientific world point of view, that we didn't find anywhere else in the local in the region. And actually, that has been now understood to be a lab contamination and nothing more. I will say that we have to expect only a matter of time that we will see other variants. This virus, we call it RNA virus. Viruses are constantly looking for one thing in this world, and that is to replicate. And they're finding a host, and they found the host in us. It may have come from an animal, so we call it zoonosis, but is now endemic in humans. And all it wants to do is replicate. When it replicates, invariably it makes these mistakes. These are natural occurring mistakes. A lot of times mistakes result in nonsensical changes, but every now and then they result in a new variant. A lot of times these variants are not even of variants that we call interest. When enough things happen and they become either more transmissible or more virulent, that means they cause more severe disease, or they call what they call immune evasion. That means that they escape our antibodies, our therapeutics, our vaccines. Well, that's when they become a variant of interest, variant of concern, et cetera. So don't be surprised. Actually, expect there to be new variants coming down the pipeline. Not every variant that comes down the pipeline, even the vast overwhelming majority of variants that come down the pipeline, will be anything to worry about. But because this virus is known to make these different mistakes, mutations, the chance of needing a seasonal vaccine does grow. Think about influenza. Influenza rearranges two proteins, the H and the N. You may remember that from the H1N1 days on a regular basis. And that's why we, at this time, do not have a universal flu vaccine. But I will tell you, technology, science is progressing at a rapid pace. And, you know, the time of a universal flu vaccine may not be so far behind, as is possibly a universal a COVID-19 vaccine. But for now, the one in Cyprus, the Deltacron, is not real. It's a lab contaminant. There was in southern France also 11 cases of a new mutation that they localized all to people who had immigrated from the south of France from Cameroon. That was actually described in November, and that has not spread anywhere. So that means that mutations did not give it any evolutionary advantage. So again, at this time, Omicron is currently the variant of concern that we're dealing with.
Great. Okay. And finally, I want to finish up. If you could give us some information on a pill that we're reading about in the newspapers, a COVID pill, as it were, and how exactly is that a preventative? Is that a symptom reducer? What exactly is this thing going to do for us?
Yeah, there's two companies, Merck and then Pfizer, that are coming out with oral antiviral medications. The Merck drug is very modest at best in terms of its efficacy. So we looked at against placebo. It only reduced the chance of someone being hospitalized by 30%. So I will tell you that most likely that will not be a big player once it becomes widely available. The Paxlovid or the Pfizer drug is a different story altogether. When you look at people who didn't take the drug versus those who did, it was an 89% chance decrease in progressing to the COVID-19 syndrome that you would need hospitalization and death. So that's an incredible reduction. And again, it's oral, which means you don't need a injection. You don't need to go to an infusion center. Right now, Holy Name, is like other institutions in Bergen County offering sotirumab, which is a monoclonal antibody made by GSK. We, had large amounts of patients that we were preventing from progressing by giving various monoclonal antibodies. We realized, unfortunately, that with Omicron, the Regeneron and Eli Lilly products no longer had any efficacy, but the GSK sotirumab does, and we're still very thankful that we have that to offer to our sickest patients, those who are most at risk for progressing to severe and critical disease. But again, it requires either an injection or in some cases a subcutaneous injection or intravenous injection. The availability of oral drugs will be a game changer. I would caution that it's a couple of negatives. The Pfizer drug is boosted with something called ritonavir. There's certain drug-drug interactions. So before you go off and just take it, you're gonna have to talk to your doctor and see if you're on any medications that may be affected by that combo drug. It's 3 pills twice a day. So 6 pills a day times 5 days, that's 30 pills. That's a large pill burden. So, if someone is gonna take it, you don't wanna just take it for a day or two and I feel better, I'm going to forget about the rest of the pills. This is a commitment to take 30 pills over 5 days, and some people may not be willing to do that. And again, you have to take it within the first 5 days. This is beyond the scope of our discussion today, but COVID-19 exists almost in 4 different distinct clinical scenarios. And so these pills, these antiviral pills, work best early on in infection. So you have to take it within 5 days of getting a positive test, or 5 days within symptoms. So again, it's a very welcome addition to our armamentarium. By no means is it an exchange for getting a vaccine. It's a complementary issue, but we'd rather prevent the disease than to have to treat it early on. So again, that's good news. There are, as alluded to earlier at Holy Name, we were hoping that this would be distributed directly to hospitals like us, like other hospitals in the area. Right now, it seems that the federal government will be buying all the medications and distributing it versus the Department of Health. And it looks like it might be going to chain pharmacies first to increase the geographic distribution. So we're still a little unsure of the availability, and that's something that's going to have to be worked out. The supply is very limited. So in the beginning, it certainly will be limited to availability for the very, those with the highest risk factors, right? So not for the average person who, just wants to prevent getting a stuffy nose or runny nose. But eventually, hopefully, those supply chains will resolve. And people can think about it as perhaps as like Tamiflu with influenza. Tamiflu you have to take within 72 hours. It's 2 pills for 5 days. This is much more pills. You have up to 5 days to take this medication, but certainly very welcome news indeed.
Well, great. Well, I see we've been together for an hour now, and that was about the witching hour that we were going to wind this down. I think the information that you've given us has been just tremendous. I hope the residents of our town got a lot out of this. I know I did. And I very, very much appreciate it. And this is just another example of how thankful we are to have these experts right here in our town, here at Holy Name, to be able to help us, keep us safe, and keep us healthy. So on behalf of everyone on the town, I want to thank you, Dr. Sagar, and I know Dr. Ironman, you were a great listener this evening, but we'll have you back as well. And I thank you for everything that you've done for the residents of Teaneck and the greater communities that Holy Name serves. I hope we don't have to have another one of these. And I hope as the spring comes together, perhaps we can start to live a little bit more normally. So again, I thank you all for coming. Thank you, Deborah, for being here. And I look forward to, as they say, a time with no masks, sunny days, and normalcy. All right. Good night, everybody. Thank you very much.
Thanks,
Thank you very
everyone.
much.
Thank you, Mr. Mayor. Okay.
Thank you.